dunker with the shot clock at 5.
If you look at Steph Curry, he was the MVP last year. And some people thought, oh, he's the best that he could ever be. Wrong. This year, he's much better than he was last year, even though he was an MVP. The team is much better than they were last year. They're breaking all kinds of records. And there's an example how a team who's already at the top of their game, won the NBA championship, now have even strived, and now they're even at a much higher level. So you can always get better. But it's not just the individual players, it's the whole system, it's the coaches, it's how they train, it's really the culture.
That's Dr. Tomas Aragon, health officer for San Francisco, talking about quality improvement with a Warriors twist.
It's really about transforming the culture into a culture of problem solving.
So why is that important?
Everything is changing so rapidly that people who just continue to do what you do today into the future, you quickly become obsolete.
And how do we avoid becoming obsolete? Through quality improvement.
Okay, this is what we should have in there. If anything, yeah, what's sufficient?
Dr. Priscilla Chu is the Quality Improvement Coordinator for the San Francisco Health Department.
One of the things that we're starting with is having just a few tools.
Dr. Chu is referring to tools like the A3 and the 4 strategic questions, which aim to clearly identify objectives and get at the core of structured problem solving.
I feel like the tools help get people started thinking about what am I doing to improve.
Most recently, the Environmental Health Branch of the Health Department took on a quality improvement effort to streamline their director's hearing process. The director's hearings are public meetings where environmental health violations are heard for a final decision by the health officer. Janine Young is a senior health inspector.
In essence, we're breaking the director's hearing process down to its little finest parts before we rebuild, because what we want to rebuild is something that will improve the experience of those customers. Then you end up streamlining everything, and then you have much happier customers at the end of the process.
Streamlining processes is beneficial to both customers and DPH staff.
One of the pieces that most excite me, that if we can look at our processes and we start finding ways of streamlining so that our staff has time back, then the staff can utilize that time to do the work that they really would like to do. They will be able to do division-wide work. They will be able to develop themselves professionally.
It's the team approach that makes quality improvement successful.
I think that's one of the best part about quality improvement, is it really truly is a team approach. Because if I was looking at the director's hearing process alone, by myself, then I will guarantee you I would probably come up with a process similar to what we're doing right now. But it's having those other eyes looking at the process, and you're going to get a whole different view in addition to your view.
One of the challenges with performance improvement is that some people think that performance improvement is something in addition to their work. Performance improvement is the work. It's not something in addition to work, it is the work. It's a mindset built on the values of humility, trust, and teamwork. It's something that you experience every single day. In the same way you expect basketball teams to get better, you expect your doctor to get better, you expect the teacher, the people who teach your children to get better. In the same way that we expect that, we also should be expecting that of ourselves.
It starts with that acknowledgement that things are not perfect and that there is room for improvement. So having the attitude of inclusiveness and also the humility to say, okay, we're gonna do better tomorrow.
One of the things we need to do is we need to go beyond individuals just getting better. We actually need to talk about how do we get better as a team and how do we get better as an organization. And when you do that, you really do a much better job of delivering quality services for the community.
Investing in improvement was well worth it for the health department's human resources team. In 2014, they took a closer look at the hiring process for registered nurses and found that it took a whopping 190 days to hire a nurse. Within a year, they reduced that time to between 45 and 60 days, a 76% reduction in time spent hiring. Reducing hiring time was crucial not only to save money and staff time, but also to increase hiring as the Affordable Care Act took effect. The HR team credits the quality improvement approach for helping them streamline their processes.
Things are always changing. If we don't change, someone's going to change us. So I think it's just prudent of us to say, hey, look, things are constantly changing. We need to change. Well, what kind of change is going to best serve the department, best serve staff, best serve the community? And I really see the quality improvement as a process that will best serve all of those important roles.